Imagine, or maybe you don't have to imagine because you've experienced this before. This pain, this sharp pain that comes out of the blue. It just hits you like a ton of bricks. You're wondering, oh my gosh, is it my appendix? But my appendix is gone. What the heck is going on? You think back, was it something I ate? Did I have something bad? Is anyone else sick? You pause some antacids, but nothing seems to make this pain better. Howdy y'all, Dr. Islam here, aka your poop guru, trying to give you the best tips and tricks to help out with your health so you can live your best life from the top all the way down to your bottom. So in today's video, we're talking about that bad pain called diverticulitis. Yes, you may have had it, or you know somebody who suffered from this. We'll talk about what is it, why it hurts, and I'll give you 4 tips on what you can do today to prevent this from happening. If you've had diverticulitis, then you know what is the pain that I'm talking about. And if you haven't, don't you want to be sure you never get this? Guys, let's talk about poop. So I'm gonna tell you a story about a patient of mine named Nancy. Nancy was a baller. Oh my goodness, she was so active. She was active in golf, in tennis. She played almost every single weekend. She was a runner as well, and she was a CrossFitter as well. She was a very physically active person, and she really had no other medical problems. But all of a sudden, one night, she had this severe pain on the left lower side of her abdomen. It was sharp. Nothing made it better, nothing made it worse, and it woke her up in the middle of the night. It was so intense, it caught her breath, and she did not know what to do. She tried antacids, Pepto-Bismol, moving around, nothing made it better. So she called her husband, they went to the emergency room, they got a CAT scan, and it showed that she had diverticulitis. Now Nancy's case was relatively severe, so they actually had to have part of her colon removed. She did well post-op, and she did fine, and she still continues to see me. So what exactly is diverticulitis? This is very different from another thing you may have heard about called diverticulosis. 2 different things. So diverticulosis are small little outpouchings in the colon that's very common for people to have, usually as a consequence of age, low fiber, or constipation. A lot of people have diverticulosis, not a big deal whatsoever. But on the occasional time, sometimes those diverticulosis or those pockets can become inflamed and it can cause diverticulitis. That itis means inflammation. That's inflammation of the osis. You got that? That's what that is. And so diverticulitis is when part of those outpouchings become inflamed, either from stool getting stuck in there or any number of different reasons. And that inflammation causes the pain, fevers, and chills, and can make people feel really, really bad. Now, most cases are mild. They can be treated with bowel rest, fluids, and antibiotics. And for the vast majority of people, this is the natural course of diverticulitis. But in a subset of patients, it can be so severe where you develop really bad pain, maybe a tear in the colon, maybe an abscess, in which you may need surgery to get part of your colon removed. Now, if you've had the misfortune of having diverticulitis, I know this all sounds so familiar, but if you haven't, good for you. That's really good news to have. But there are some risk factors for developing diverticulitis. Number 1 is lack of exercise. Now, exercise is literally the best thing you can do to improve your health, and it's been shown to decrease your risk of inflammation of those outpouchings. Number 2 is smoking. Now, come on. Are you still smoking in this day and age? You know that smoking is terrible for you. You shouldn't do it. It doesn't help out anything, and it does increase your risk for diverticulitis. Number 3 is obesity. Obese individuals have a higher chance of developing diverticulitis, complications from diverticulitis, and recurring episodes of inflammation as well. Number 4 is aging. Getting old is terrible, isn't it? Trust me, I know, I understand. But as we get older, the risk increases more and more and more. At the age of 40, 10% of the individuals will experience diverticulitis. Over the age of 60, almost half of those individuals will get diverticulitis. And number 5, diet. A diet that is low in fiber, high in fats, high in meats, will increase your risk for developing diverticulitis. And then lastly, certain medications. There are medications that are known to trigger inflammation, things like non-steroidal anti-inflammatory drugs. Aleve, naproxen, Advil, Motrin. These are very common triggers to developing worsening and recurrent diverticulitis. So what can you do today to minimize your risk or to at least prevent this from happening? Here are 4 tips I recommend. Number 1, you have to change your diet. I just told you how diet plays a role in gut health and diverticulitis, and this is one of the more effective things you can do. If you eat a lot of meat, you gotta minimize that, especially red meat that increases the amount of inflammation. If you have low fiber, increase that fiber. Take more vegetables, have more fruits, use fiber supplementation. This works, this is natural, and it'll help decrease that inflammation. I want to thank you for watching. If you haven't already, don't forget to smash that like button, comment down below. Number 2, drink more water. Listen, if you're gonna have a better diet, you might as well add more water to that. Water helps out with the fiber to allow the things to get pushed through, decreases your risk for constipation, decreases your risk for developing those diverticulosis, which in turn will decrease your risk for developing inflammation. Drink that water, it's good for you. It'll help lubricate things down and make it easier for you to poo and decrease your risk. Number 3, put down those cigarettes. Yes, don't smoke. Come on, don't do it. There is literally nothing worse for your health than smoking. And number 4, get moving. Yes, exercise will help out with your risk. It'll minimize it. It'll help out with your mood, help out with your gut, and it'll make things so much better. It is literally the secret sauce when it comes to having a healthy life. So here's what I want you to do. This week, do 2 things that's going to decrease your risk for diverticulitis and have you have a healthier life. Go for a brisk walk, add more water, do this, you're going to feel better, your gut will love you, and your risk for diverticulitis will go down. So my question today for you, what would you add to this list? What would you change? Have you had diverticulitis? Comment down below. I would love to hear what you have to say. I want to thank you for watching. Don't forget to smash that like button. Like, share, and subscribe. And if you haven't already, don't forget to subscribe to our weekly newsletter where you can get great tips and tricks like you're learning in this video. All right, guys, and don't forget, let's talk about poop. Thanks, guys.